Good day and welcome to CDLS Washington Town Hall for Healthcare for CAF members posted back to Canada. Congratulations on your return to Canada. The following will be the medically relevant administration you will be required to conduct prior to your departure. Please note that once you have left the United States, this administration will be extremely resource intensive on you, and the CF Health Services HQ at Washington will have very limited means to assist you. Now for CAF member specific medical portion, your first step will be to collect the sum of your medical records while you were posted OutCan. Please note that your behavioral health file, mental health, may be a separate request at some locations. Ensure you collect all files from all MTF and other treatment providers if utilizing an in-person method and going to their medical records section to do so, or to use the US MHS Genesis Health Portal. Again, ensure you have collected the entirety of your records from clinical notes to behavioral files to labs and results. Gaps in your file may have severe impact to your future medical needs and potential VAC claims and files. We are constrained by US laws and cannot understate the significance of this step. Now for CAF member specific dental, your dental file will be the same and to be hand carried by the means of your choice to your gaining dental unit. The Royal Canada Medical Service uses a different information system than our dental colleagues and cannot upload your dental records onto your CAF dental file. Ensure you have collected the entirety of your records. Now reference advances. If advances were issued, please note that you are personally accountable for this and are expected to communicate updates or reconciliation once MSH International or Canada Life has processed your claim. We understand that there are still significant delays in processing and don't enforce a specific timeline at this time. Your advance will be sold to your gaining unit for you to reconcile when able. Your gaining OR can always reach out to CDLS Washington for assistance in processing your reconciliation. Verify that all balances have been cleared with your US providers because we've had files sent to collections which will negatively impact your credit score. It is your responsibility to ensure your bills have been cleared. If there are any outstanding issues prior to your departures, please reach out to the medical team as soon as the issue is identified. Reference Dependent Specific PSHCP PSDCP. You will be covered under the comprehensive coverage for up to 90 days after your COS date. You will have to re-enroll into provincial healthcare, and we recommend you inquire directly as to the requirements for your province. We do advise that you keep in mind that many provinces waive the waiting period for military families. You may also utilize the College of Physicians website to source and contact physicians in order to find a new family doctor. Again, it is sometimes helpful to explain the situation and that you are a military family. Reference the med records for dependent. It is recommended that you collect the entirety of your medical records to include dental, much like your service spouse, in order to ensure continuity of care and completion of records. Conclusion. This concludes the medical portion of the out clearance process. To summarize, we discussed the comprehensive collection and submission of clinical notes, advanced reconciliation and follow-up, as well as PSHCP and provincial healthcare. We do recommend that you give out a website run by MFS US a look, where you can find the most updated information and contacts. We are here as needed and must abide to a very specific process as far as the US health systems. We thank you for your diligence on the matter and welcome any questions, concerns, point of clarification to our plus box or directly to our health services coordinator. Wishing you a happy and healthy return to the true north.